Dr. Manjit Singh, Director, International Affairs of our college. Today's distinguished speaker, Dr. Armin Najjar, teaching faculty, postgraduate students, external delegates, and dear interns. At the outset, I welcome you all to the week-long international webinar series titled PMS Mastery. This is indeed a good opportunity to top up your knowledge tank and rejuvenate your daily work, learn innovative tips and tricks, key tactical designs, and gain essential tools for carving our role in emerging trends at various spheres of dentistry. PMS College of Dental Science and Research, as the organizer of this event, will definitely help the delegates to be a part of credible, content-driven, and webinar series. The ultimate beneficiary or the learner will be the participants if he or she observes closely and imbibe what is best for them and how best these innovations can be iterated into their daily clinical practice. Webinars are indeed powerful tools and early accessible resources to connect globally and gain knowledge from multiple angles on the topic discussed. Interaction with audience adds an extra dimension to webinars, and also webinars are beyond borders. The hearing perspectives and experiences of experts from the different continents and bringing their best practices to the comfort of our laptops, LED screens, and indeed our smartphones is a powerful act. PMS College of Dental Science and Research will always remain a national leader in meting out quality dental education, initiate out-of-the-box thinking, and be an epicenter of knowledge sharing. Thank you very much, and I welcome all the resource persons and all the external delegates who have indeed accepted our invitation and to have a fruitful learning in the upcoming webinars and return enriched. Thank you once again.
Thank you, sir. Dr. P.S. Taha, Chairman, PMS College of Dental Science and Research, pursued dentistry as his career at Government Dental College, Trivandrum, and accomplished his BDS degree in 1975. His fire desire in profession made him to join the very alma mater as a lecturer in 1978. After a year in service, he ventured proceeding to Middle East for better prospects. His determination for advancement of knowledge prompted him to return in 1982 to his college for the postgraduate degree and continued as lecturer in periodontics. It was a unique experience and challenge for him as to share the responsibility as a lecturer and a student at the same time. He successfully completed his MDS and was promoted to assistant professor in periodontics. In 1987, Dr. Taha again ventured to Middle East to fulfill his long-cherished dream of setting up an outstanding healthcare facility, Taha Medical Care Abu Dhabi, extending world-class medical and dental services. He got trained in UK, USA, South Africa, Malaysia, Singapore, and the Middle East, which gave him vast exposure to the world of dentistry and dental education. This made him feel the need to add a twist to his career, and in 2002, he established the first self-financing dental college in Kerala, Trivandrum, which is also the first NAC-accredited health education institute in Kerala and stands tall today as one of the best 40 dental colleges in India, rated by India Today. Dr. Taha had a strong will and determination that fueled his idea of not restricting him to limitations. He introduced the concept of international faculties visiting regularly to the college by getting academic partnership with international universities like Rutgers University, USA, Geneva University, Italy, for staff and student exchange program, and organizations like European Medical Laser Association, Swiss International Academy of Osseointegration, and Knightsbridge Academy, UK. He strongly believes that this institution should be a symbol of excellence for the profession and should serve the society, surpassing all the standards today and in times to come, to churn the global dentist of tomorrow. In recognition of his vast contribution to the profession and the society, in 2003, Government of Kerala nominated Dr. Taha as a member of Dental Council of India and member of Norca Roots Government of Kerala. Among the various awards and recognition received, worth mentioning are the Dentist Shrestha Award by Kerala Dental Council, Dental Excellence Award in 2019 by IDA. For his service in Abu Dhabi, he received Best Social Service Award from Embassy of India, Abu Dhabi, and Best Professional Award by NRI Welfare Society. In 2019, he also received honor from the University of James, Spain for his excellence in dental education. He is associated with various national and international professional organizations like the Life Member of IDA, Asian Academy of Implant Dentistry, Indian Institute of All Implantology, Indian Society of Periodontics, International Association for Orthodontics, and Academy of Dentofacial Aesthetics, USA. His contributions to the profession and society is of a very high order, and his crusade for achieving excellence is commendable, and his futuristic vision as an academician in the present-day world deserves accolades. It is indeed my extreme honor to welcome our beloved chairman, Dr. P.S. Taha, to formally inaugurate the program and to give the inauguration address.
Thank you, Dr. Gayatri Nair, for the excellent, words. Good morning, one and all. Principal, Director, PG Studies, Dr. Varun, other faculties, students, international speakers, ladies and gentlemen. It's yet another prestigious moment for PMS College of Dental Science and Research. As it is mentioned, PMS, the first self-financing dental college in the state, also is the first one to conduct the International Faculty Week of its kind in India. Fortunately, we had the opportunity to conduct the International Faculty Week in 2019, and we had more than 7 speakers from different parts of the world. They could physically come here and conduct the program in February. And this year also, we had planned for a bigger conference, not online, but we were expecting everybody to travel, but unfortunately, due to the COVID situation, the things have changed, and COVID has given as a opened an opportunity for us at least to have an online programs like this. And it has opened our eyes to see, to understand that, nothing is impossible. Now, people from all over the world come to one platform at any moment of time and can, interact and can, share their knowledge. My aim in my life is to give the best possible to my profession, back to my profession. And for that purpose, I strive hard to see that the best dental education is provided to our students and to make them the global dentists of tomorrow. I don't want to elaborate much on this one. I thank Dr. Armin Najat from Future Dental Academy, Germany, Dr. Stefano Benedicenti from Genoa University, Italy, Dr. Kabilan from Rutgers University, Dr. Anil from Rutgers University, Dr. Fabio Sevastano from Neuromuscular Orthodontic Academy, Dr. Simon Nenki from Singapore University, Dr. Henry from Singapore University, Dr. Lewis Klein from France, Dr. Ahmad Gamal from France, from Fujairah University, Dr. Dana York, from the president of EMLA from France, Dr. Laurie Fletcher from New York University, USA. I thank in advance each and every speaker for their, for accepting our invitation and sparing their time to share their the excellent knowledge for the benefit of our students, our fraternity, and our country. Thank you all very much and wish you all a very, very, very wonderful International Week. And I declare that the International Week is inaugurated. Thank you. Thank you very much.
Thank you, sir, for your words of wisdom. Now, I invite our principal, Dr. Sudeep S., for the principal address.
Thank you, Gayatri. Respected Chairman and the guiding light of PMS College, Dr. P.S. Taha. Respected Dr. Manjit Singh, sir, Director, International Affairs. The chief guest or chief speakers of the day and PG Director, Dr. Rajesh Pillai. Associate Dean Clinics, Dr. Varun Bhargavan Pillai. From today, the week for enlightenment have come to reality. our visionary chairman's initiative for the students and staffs of the college to improve the quality and to inspire and to motivate the need has begun. This excellent initiative is the most powerful tool to empower knowledge among the attendees. So, dear students and colleagues, sit back and empower your knowledge from these power-packed presentations. Thank you.
Thank you, sir. I now invite Dr. Manjeet Singh, Director, International Relations, PMS College of Dental Science and Research, to give the felicitation speech.
Thank you, Dr. Manjeet Singh. I'm sorry, I forgot to mention your name.
That's perfectly fine.
Thank you.
I now invite Dr. Manjeet Singh to give the felicitation speech.
I bring greetings from Bahrain. Dr. Taha, the chairman, Dr. Sudeep, the principal, Dr. Rajesh Pillai, director PG, and Dr. Varun, and the online members of the international faculty world over. Our students and the faculty of PMS College. Ladies and gentlemen, memories of the last fabulous International Week are still afresh. What a gala event it was. But due to pandemic only, this pan-academic International Faculty Week has been created by the faculty very nicely. In keeping with the traditions in line, this year online celebration has been organized by the very creative organizing team of the PMS under the leadership of Dr. Taha. It's my proud privilege to greet and felicitate the eminent competent speakers from around the globe. Dr. Taha has already taken their names. I would love to not to repeat the same. Very successful journey of PMS from the genesis in 2002. The institution has earned accolades in the professional world of dentistry and is due to profound contribution of the faculty, the international faculty, the diligent students, despite the accolades of securing ranks in top institutions and merits earned by the students. We have no intentions to rest in our laurels. Right from the inception, we have continued our endeavors and we will continue for its further advancements. Right from the beginning, Dr. Taha and myself have gone around world over, be it international affiliations, like we have been able to establish international affiliation of student exchange program with the Rutgers University, with the, of course, kind support of Dr. Anila Deshane. We have been going to the exhibitions, institutions, universities to search for the best of the things and present to you like a center. Trust me, we have put in all efforts and I salute the faculty, Dr. Taha, to look for and present the best to the students so that they can gift this art and their skill to the society. It is an institution It's really a gifted institution for excellent professional development to serve the profession and society at large. Let us celebrate this great International Faculty Week 2021. I'm sure next year we will celebrate in person. I invite you all for this wonderful event, and let's share the newer things today. We have two great speakers. That is Dr. Arman, who is the champion of champions in implant dentistry, and Dr. Stefano, who is a king in lasers. Let us hear them today. And onward, of course, the whole faculty week, we will be sharing knowledge. This is knowledge in college, out of college, for everybody. Thank you so much. And my greetings again, once again, and my best wishes for this wonderful week. Thank you.
Thank you, sir, for your inspiring words. I now invite Dr. Varun Bia, Professor and Academic Dean Clinics, to deliver the vote of thanks.
Thank you, Gayatri. Most respected Chairman, Dr. P.S. Taha, Principal, Dr. Sudeep S., PG Director, Dr. Rajesh Pillai, Director, International Affairs, Dr. Manjeet Singh, Senior faculties, colleagues, delegates, my dear students, ladies and gentlemen. It is my proud privilege to cast the vote of thanks on this wonderful occasion. International Faculty Week was started in 2019, and the program was the brainchild of our beloved chairman, Dr. P.S. Taha. I'm glad to say that the International Faculty Week was considered to be one of the most successful scientific conclaves that ever happened in our institution. This program was intended to be continued every year to bring global knowledge and renowned speakers across the world to PMS platform for the benefit of students, faculties, and other delegates across the country. It started as a physical meeting in 2019, and this year, due to COVID pandemic, we had in fact forgotten about this event due to many other crisis management. However, it was once again due to our insistence of our chairman, Dr. P.S. Taha, who wanted to convert this challenging opportunity into a proper opportunity. And in this event was organized this year via online platform. The chairman also ensured that we have more scientific deliberations from renowned international faculties this year compared to the previous year. I extend my heartfelt thanks to our chairman for all his efforts in reinitiating this program, his motivation and support in making this international event possible this year. Thank you so much, sir. I would like to thank our dear principal, Dr. Sudeep sir, who was a core member of this organizing team, and for his constant support and timely advice was very valuable in this occasion. I thank Dr. Rajesh Pillai, our PG director, for his innovative ideas and motivation, and he was instrumental in coordinating and bringing two excellent speakers for this faculty week. I thank Dr. Shinu, one of our core members, for giving all his inputs. I extend my thanks to all the core members of organizing committee for their help and support. Special thanks to the clinical in charges who had rescheduled the appointment and managed the clinic very well. Words are not enough to thank Dr. Biju Balachandran for his support and help extended during the crisis time for all the arrangements done from the administrative side. I thank Dr. Kiran, Department of Community Dentistry, for all his technical support and for the smooth conduction of the registration program. I thank Dr. Gayatri, our host for the day, for her role today. I would like to thank our HR manager, Mrs. Roshni, for her support, and office staff, Maya, Shubha, for coordinating with all the delegates. My sincere thanks to all the international speakers who consented to share their valuable knowledge in this platform. And I take this opportunity to thank the IT in charge, Mr. Sujit, for setting up all the gears necessary for this exclusive online program. And I appreciate his sincere effort to ensure the smooth online streaming of all the sessions. Last but not the least, I thank all the delegates who registered for this program and made this a grand success. Thank you and Jai Hind.
Thank you, sir. With that, we have now come to the end of the formal inauguration ceremony. I request you all to please rise for the national anthem.
and made this a grand success. Thank you and Jai Hind.
Thank you, sir. We have now come to the end of the formal inauguration ceremony. I request you all to please
Punjab, Sindh, Gujarat, Maratha, Dravida, Uttara, Vanga, Janayana, Himachal,
ई बॉक्स में
मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Without wasting much time, we shall start with the first session. The first session will be by Dr. Amin Najat on the topic Modern Minimal Invasive Therapies in the Field of Dental Implantology. I would also like to welcome our moderators for the first session, Dr. Sudeep S. and Dr. John Roshan. Dr. Sudeep S. completed his BDS from Annamalai University in 1994 and MDS from Rajiv Gandhi Institute of Health Sciences in 2001. He has also underwent training in implantology and aesthetic dentistry and orofacial pain. He is currently working as a professor and HOD of the Department of Prosthodontics in PMS College of Dental Science and Research. Dr. John Roshan completed his BDS from Rajiv Gandhi University of Health Sciences and did his MBS from Annamalai University. He is also a member of the American Academy of Implant Dentistry. He is currently working as the head of the Department of Implantology, PMS College of Dental Science and Research. I now hand over the session to the moderators.
Thank you, Dr. Gayatri. Yeah, Dr. Roshan is there.
President Garvitali.
Yeah, Dr. Armin, welcome to this session. Dr. Armin studied dentistry and received his doctorate at the Johannes University in Frankfurt, Germany. He is doing his private practice in Frankfurt and done numerous national and international study trips. He's a specialist in the field of dental implantology, aesthetics, and periodontology. He has a certificate for diplomate ICOA and nomination. And he's a developer and advisor of minimally invasive method of implantation. He's placed and restored more than 23,000 implants. And is a developer, founder, and consultant, and CEO of Champions Implants. He is the president of German Association of Innovative Practicing Dentists. He is a winner of Census Innovation Medical Award, Dubai. He is active as a lecturer at renowned international professional conferences and focuses on immediate implantation and minimal invasive method of implantation. His main philosophy is the simple implantation with simplification of the procedure and new designs of implants. I welcome Dr. Armin for this knowledgeable session. Welcome you, sir.
Audiences, any doubts, please put it in the chat box and will be addressed at the end of the session.
Dear colleagues, it's always a great pleasure to speak during the International Faculty Week in PMS College of Dental Science and Research with my very good dean, Dr. Taha. My name is Amin Nejad, and my topic today is modern minimally invasive therapies in the field of dental implantology. 2-3 times I was already in PMS College, and we had really a wonderful time. They have a great staff and very interesting in implantology as well. And okay, we had some good food as well, Indian food, and everybody was really excited, and it was really good time. And I hope really that I can come soon again. It was Walt Disney who said, "If you can dream it, you can do it." A nice sentence, and I hope that one time in future you will dream it about implantology, minimally invasive, and you will do it. And you can do it, I'm sure. The results of many cases which you can do are amazing. And sometimes really you don't know, even as a dentist, where the implant is placed. It was an accident of a young man, and you really don't see where we placed this implant. Nothing is more constant than the change. And I see in this changement as well a chance. When the wind of change blows, some build really high walls, other windmills. Today, I would like to give you 10 golden rules to take with you. The first question: who is the best able to do implants and to provide prosthetics? You know, one can see that an endodontic treatment is very similar to an implant procedure. And in conclusion, every general dentist is capable and should offer implantology in their own practice, in their daily work. The good thing is that implantology, it's much more easier than an endodontic treatment. So, implantology is nothing out of the ordinary. And the best documented field of dentistry, which achieved proven success, more than 93% in 20 years. And the good thing, you don't need such technical equipment in your practice. Even we don't transform ourselves to astronauts, because we do not practice open heart surgery. It's in the mouth, it's a treatment like the endodontic treatments, procedures, like extraction of tooth, like resection, like fillings, aesthetic dentistry. So why we should change our routine in everyday practice? Isn't it ridiculous to transform ourselves to astronaut when planning and placing an implant? No, we don't need such transformation ourselves to astronauts. Since 1995, I really treat my patients as well like this, with a normal kayak and so on. I don't panic. My staff didn't panic at all when an implant was placed. No, nothing. And during our faculty curriculum program, implantology minimally invasive, it takes time 1 year for the young students and young colleagues, and we treat the patients like this, nothing else. The third golden rule is take no health risks for your patients, work with the nature, not against it, protect the periosteum, and we will speak about the biointegration as well. Take no health risks for patients, including Tsuguma implants. This is not a job for a general dentist and for a young student. This is really a job for the maxillofacial surgeon. MIMI means minimally invasive method of implantation, and it's the most modern process in dental implantology, state of the art since 25 years already. If the patients ask you, what is MIMI? What does it mean? You can explain it very easily. If you want to fix some large pictures on the wall, do you peel wallpaper away from the wall before drilling and inserting the dowels? No, you don't. Especially not if you would know that the wallpaper feeds the wall. So, no need of flaps. And the good thing is, our patients already are very familiar with these minimally invasive surgical procedures. They know all procedures like the keyhole surgery and knee operations, hip operations. These are all minimally invasive therapies and the orthopedic surgery with endoscopic instruments. Before 1964, the procedure for placing 1, 2, 3, 4 stands was totally different than these days. They opened the chest, thorax, and many complications, many infections, and so on. And these days, there I found a film. These days, it's like Charles Dotter did it in '64. He invented the angioplasty and the catheter-delivered stand without opening the chest thorax. And what about in dentistry? Have we made any progress in implantology? Hard battles have been fought, and unfortunately, they are still being conducted in implantology. We wanted to see the bone. We wanted, really to know where we are drilling, where we are placing the implants, and so on. Why I had this depression? Because I forgot the basics. What is the one of the most important part of the bone? It's the periosteum. The periosteum is a thick fibrous two-layered vascular connective tissue membrane covering the surface of bones, except of the surfaces of the joints. The function of the periosteum: the bone is nourished by the periosteum. The periosteum actively participates in bone growth and repair. The inner cambium layer possesses even osteogenetic potential. If you're injured by peeling the periosteum from its bottom, from the bone, periostitis is an inflammation of your periosteum. During growth and development, it contributes to bone elongation and modeling, and when the bone is injured, participates in its recovery. Dear colleagues, what are the conclusions? A systematic detachment of the periosteum inevitably leads to malnutrition of the bone. The feeding pump of bone is restricted. And if the feeding pump of bone is restricted, the biggest point for peri-implantitis is the iatrogenic traumata, which you did it while doing flaps. And besides, what our patients want to have, they want to have nice smiles, white teeth, and sexy appearance, and so on. They don't want to have implants. Yes, first they want to have a nice smile. They don't want to have pain, especially no iatrogenic traumas. These are the results of my treatments 28 years ago with my father, and we learned about it. Protect the periosteum, and we changed the term from Barnemark osseointegration to biointegration, with including the soft tissue. And it was Adele with his group 1981 who shows especially that the light, even the light of our chairs, will create billions of osteoclast activities. And do you want it? Mimi is an art. General dentists are able to do it in their daily work as well, and your patients will love you. So, since 1995, there is really a revolution in implantology. We speak about biointegration instead of the term of Barnemark osseointegration. And now we will show you that Mimi doesn't mean that we are working blindly, because we use low speed, also with the green handpiece on the chair. We don't need really a micromotor, and we have the sensibility in our hands for the cortical plates. Also, in this case, you can see very well that you cannot perforate the buccal or palatine plate of the bone. It's like an endodontic treatment where you always keep in the canal, or in implantology with Mimi technique, you still keep in the cancellous part of bone. You can see it here. Yes. Buccally and palatally we have the plates and always the implant, and also before the drillings keep in the cancellous part of bone. Very important. The art lies in simplification and not in technical arms race. So you are not needing CBCTs or for the normal cases in your daily work. SNP means cortical navigated implantation procedure, and it's like the endodontic treatment. You start with 20. I have here and I start the film. You start with 250 RPM maxillary, and in the strongest part, in the cancellous part of bone, you reduce down to 70 RPM, and with the three-angled conical drills, you already condense the bone laterally, and it's amazing. Yes, you are guided. It's our first guide which we are using, and we are using the nature for us. We are working with the nature and not against the nature. And the periosteum still keep on the bone without being injured. So the fifth golden rule is low speed, SNP navigation, prosthetic guides, and please no any more mucoperiosteal flaps, and in the prosthetic time as well, no re-entry of the gingiva. Here you can see animation and live surgery in one time. We are drilling very, very slowly with three-angled conical drills. These are already condensers. They condense bone. They don't take away bone from the body. And you are guided with SNP. It's very easy. You can control it with a metal sonder. In every direction you feel a bone, and then you take the second three-angled conical drill, and then you are able to place already a 3.0 millimeter diameter talip. It's a one-piece implant for fixation, removable prosthetic. NIMI seems to be very easy, but you must understand where you are. You must control yourself. In this case, for fixation, lower jaw prosthetic, you see the 4 one-piece implants, and they are really in the middle part of bone. The second guide which we are using, these are the champions guides created of Professor Dr. Ali El-Hamid, very nice friend of mine, and you can already always use them, reusing them after sterilization for another patient. You can form them, and you see exactly the distance from the implants, and it's fantastic procedure and very easy to use. So you can really have a good measure to keep the distance of each implant in the mandibular, the lower jaw, or as well naturally in the upper jaw. An important thing today, which I want to give you on the way, is do not lead yourself on the black ice. That means no template guided navigation based on CBCT. And in these days, there are a lot of publications of articles and so, but in truth, it's not correct. Modernity does not mean that you have to upgrade or buy new technology. Instead of this, you should understand only bone physiology. The definition of MIMI, the minimally invasive method of implantation, no need of CBCT and micromotor. We have our SNP navigation, cortical navigation implantation procedure. Without mucoparietal flaps, immediate implantation is the future. We will see at the end of this presentation. To protect the periosteum maximally, to prevent poor bone nutrition, we are using low speed without irrigation, no micromotor, and we check always the cavities with the metal zonder. We have controlled lateral bone condensation. We distress the crestal bone in D1, D2. We will see in some minutes. Primary stability comes only from the cancellous bone, and we have no re-entry of the gingiva in the prosthetic time. Naturally, there are existing so many scientific studies about MIMI procedure, and I don't have the time for explaining all these good international universities. But in conclusion, MIMI is approved since 25 years. And it was a great honor to be nominated 2017 in Berlin for the best innovation in medicine, and we won the award Best Innovation in Medicine as well 2013 in Dubai in the Emirates. Yeah. 2010 I created this system, Champions Revolution, which has 4 functions. On the top in the implant, it's already the insertion tool, cover screw, gingiva former, and a part of the impression tool. With this Champions Revolution, we have only 2 sessions to fix the crown on the patient. Okay, first we start always with low speed without transforming to up to mouth, outside the mouth. We are using low speed the drill. We are guided slightly, cortical navigated. We cannot separate the bone plate easily and linearly. Now first I learned the drill as well. Low speed normally 50 up to 70 bone. With the metal implant with your hand or with a machine with 20 RPM, very controlled, very slowly. You see the shuttle. The shuttle keeps the sterility inside the implant of the temperature. The only one on the market. Now, finished already. This is the X-ray control. And through the question as well. Sessions with the patients very quickly, and it's easy when you know how it does it work. Pictures from this patient, second session, where we fit already the crown. We take off the gingiva clicks, the material is PEEK, and then we take off the first time the little screw inside, which you are taking also for fixation the abutment. So you don't have to buy another screw. Then you take off the shuttle. First time there's a possibility for bacteria to come into the implant inside. Otherwise, it doesn't smell so good with other systems. There is absolutely sterility guaranteed, and then you fix it with abutment. In my practice, normally it's also sterilized the abutment, and then you fix the crown on it. So these are the transfers for the Champions Revolution system. It's always supra-gingival. You can control it without X-ray, without contamination, and without screwing a lot out in some screws. And in the lab you need a lab analog plus a shuttle as well. The sixth golden rule is subcostal implantation, de-stressing the cortex. When you see some X-rays control with the framework as well, you see no resorption at all when you are able to implant subcostally the implants. And unfortunately, it's not possible with every implant system, only with a long enough conical design. We have 9.5 degrees, and it's absolutely hermetic against bacterials inside from the sulcus and so on. And easy to handle in the prosthetic time as well. So what does it mean, de-stress the cortex? It's very simple to explain. For an implant, 3.5 millimeter diameter. At the end, I'm using a 4.0 millimeter diameter drill. So I don't have any big connection, stress in the cortex area with the implant. Just do it and you and your patient will be happy. Here you can see a great case from a dentist in Germany. And you see as well the subquestal implantations with the Champions Revolutions. Really nicely, after 8 weeks or 10 weeks later, you get such huge aesthetic soft tissue, and this is what we want to have. Also in the maxilla, and the end, everybody was happy. The seventh golden rule, which I can give you today, is if you are needing bone replacement material, just use, if it's possible, the autologous teeth from your patient. This procedure of the smart dentine grinder is developed by Professor Itzhak Binderman, University Tel Aviv, Israel, the forefather of modern augmentation. When I saw this procedure, it was so fascinating, and really every patient losing one or some teeth know this. Yes, you can explain it, your assistant can explain it, that he will lose a lot of bone during the first 3 up to 6 months after the extractions. So my assistants all know how in 8 minutes they produce wonderful teeth material, changing to bone after some years. And I didn't know it before that we have more growth factor in the teeth themselves than in bone. Fantastic. It takes time, really only 8 minutes. You have a grinding machine, you using a cleanser, you are buffering it, and you have the best what you are needing. And also with the help of the smart grinder and with the technique of Mimi, we can say that there are no more limits for Mimi procedures. Even the IDS, it means the sinus lift internal directly, or Mimi 2, the horizontal distraction of bone without mucoperiosteal flaps. This is a case of a young lady. Very the patient was so afraid. Yes, I was filmed it, and there you can see all the procedures in one patient. We have 2 trays, pattern, 2 page trays, because in this case we are using zirconium implants. And you have a punch. Punch also means the first dose avoid the period from the first 12. Closely without manipulation. Control.
cortical plate just place very slowly, and now also this condenser 3.8 goes through this plate and now can push up without nothing. They are little chambers where you can put it out material to clean them. This chamber first previous particle size. It's not a work for dentists. They love to explain to the patient and they earn a lot of money for the patient. Really good success because you don't need anymore sterilized cows. It's like a little bowl and push it there. All is manually, without any machines, without holding, no nothing. Just do it in this way. Very soon, you cannot perforate the membrane because we are using only instruments, not sharp instruments. And when I take a drill like this, also anti-clockwise. Why not? It's a condensation. You don't take bone away, but you just condense it, and the material here you push under the membrane of the pipe. So at the end you can use it like this, where we said already the pattern of second medical. In my opinion, really the best second worldwide. There's no screw, there's no point there, no lap, no really fantastic. See very well the material under the membrane, and 3 months later we already fixed the crown on the implant. So manually you take your finger and you just take the yellow and the white 3-shaped conical drill. You approach to the cortex area just before the membrane. Then you can take the condenser and you push already a little bit the membrane, and I go always with 4.5 millimeters diameter inside, or 4.3 millimeters, excuse me, to put an implant 4.5 millimeters diameter in the material inside.
For primary stability with the champions or the patent systems, you are needing only 3 up to 5 millimeters to achieve primary stability with 30 Newton centimeter. So, okay, we have many films. If somebody wants to have some films, I can send it via WhatsApp. It's the best way to join me. At the end, I will give you my number, and then you see here the graft material. It's the teeth from the patient, autologous material from patient, and you don't have a second taking out the bone. In my opinion, really, the teeth material is better than bone itself, because the resorption, it doesn't go so quickly than with the tooth material. Okay, this is a nice case, but we don't have so much time. This is with the revolution. You see the graft material, it's also the smart dentine grinder procedure. And why don't we see the forest for all the trees? Yes, this is now Mimi 2. This technique is coming from my friend Ernst Fuchs-Schaller. For narrow jaws, without mucoperiosteal flaps, you can distract with simple instruments. You can. It's really a miracle, I see. And Ernie was, for me, the forefather of bone management. We had a lot Mission Impossible normally, yeah, but we are not Tom Cruise, but we were like Ernie. And we are using as well this SNP navigation as well, yes, with the cortical plates, buccally, palatinally, lingually, and we are starting always from lingual, palatinal side, with a diamond, with a turbine, and with water irrigation naturally, and then we just mobilize the triple layers to buccally. Triple layers means the buccal plate, we have the intact periosteum and the attached gingiva. This is fantastic that we are creating an attached gingiva in the area where we are needing this attached gingiva. For this presentation, I have mixed some films, and you see here the diamond is normal diamond, which you can buy everywhere. You cut it with irrigation. You are going through the gingiva and the cortex. You feel it as well, that you are in the cancellous part of bone. And then you can drill. Yes, you have the choice. You can drill, or you can take only the angel modulator, we call it, from Ernie Fuchs-Schaller. We have two, one for the lower jaw, one for the upper jaw. And then you can mobilize the triple layers easily to buccally. And this is it's a miracle, really a miracle. Everybody can do it, and the patients don't have any pain, and it's fantastic. Yes, it's really, really fantastic. And the other cases you see as well. The good news is as well, when you have a narrow bone, you have much place to the canal or to the sinus. It's not so oftentimes that a patient have narrow bone and no place in vertical dimension. This is the good news. So we implant it correctly. Be careful with the access, yes. And you can see as well the cone beam here. Always you start from lingually, and then you can mobilize it easily, and you will win an highness in the buccal side. Yes, you will win 1 millimeter of highness, and you see as well the bone. Yes, you see the bone, how it's mobilizing, how you can create a good cavity for your implants. Yes. I let you sing some films of this wonderful procedure, which Ernie developed 20 years ago. Nobody knew it, but he was at the end of his life, he was very popular in Germany, in Switzerland, Austria. This is a case with a patent. It was a dentist in Bavaria. They filmed it, and the patient was his wife. You see, narrow bone. He started as well with diamond, with a turban, very carefully, but through the gingiva and the cortex. Don't use scalpels, because with the scalpel you have much more bleeding than with the diamond. There's a microcoagulation and there's no blood for the patient. Don't smell so much blood, you see. So very carefully you can drill. You see always the laser measuring here 14 or 12 millimeters, and then you can insert. Okay, you can condense anti-clockwise with the drills, also with the drills, and very slowly always. Okay, these are the champion's drills, anti-clockwise as well. Yeah, these are the little tricks for the implantologist. In the future time, you will be all implantologists, I'm sure, because it makes the people so happy. The condenser 4.3, it's a blue one, and then it's a test if we get the primary stability of 20-30 Newton centimeter, and so we take an implant with the diameter 4.5. It's easy. It's not the anatomy in front of the operation, before the operation. No, it's the density of bone. I cannot say always in front, before the surgery, I take this diameter. No, in the operation time, during the operation, I decide, or I recognize which diameter I need for the bone. It's not the way that you can planify all before the operation. It's not possible. Because the bone itself, it's flexible, and you can work with the nature. So this is another case. Okay, also you know all this from your daily work, in your practice. Otherwise you can say, oh no, it's too narrow for me and I stop implantology, I never can do it. Sure, you can do it. Just learn a little bit from the films. I can send you some other films, the technique. You can work in your kitchen before you are working on the patients. And you're needing just some materials. And this is the angel modulator from Ernie and the mandibula to mobilizing very good the triple layers to buccally. And it's the feeling, it's like an extraction of tooth, yes? It's almost the same feeling which you have. And don't be afraid, don't be scary that you can perforate the buccal wall. No, you will be careful, you are working slowly, and so you can do it correctly. You see. Genau. Bone is flexible. It's not a wall like here in the future center. No, it's flexible, and everybody must do it. Besides, there's a study of University of Hamburg, Eppendorf, Professor Smets. He was showing that every titanium implant you can, using your polymerization lamp, 12 minutes, okay, and then you have more hydrophilic effects on every surface of titanium. Just activate it with light, 12 minutes long. So now you have a fantastic primary stability coming from the two plates buccally, lingually. Be careful a little bit and then you win. Okay. Also here, this is the case which I showed you. You see the bone, you see the two plates, everything you see. And it's not a mucoperiosteal plate. It's only an incision which is also minimally invasive. Also a punch. And in some minutes only you get a bone really not really enough, yes. And the great thing in this technique, it's also the soft tissue. The attached gingiva is mobilizing as well to buccally. And this is great, fantastic. Okay, these are cases from our forum on Facebook. You see how nicely they all work. In Germany, we have 4,500 dentists working with this technique with the materials, and it's amazing. I know in India you have some dentists more than we have. So you see the X-ray, the cone beam. If you merge it together, you see like this. Okay. Also, always the same. Yes, the demands of our patients are increasing. Naturally, they don't want to have pain, they don't want to charge you very much, okay? Everybody knows it. But I'm convinced as well that the world of titanium is being replaced by silicone implants. And it's very important that you understand why there is so many silicone systems on the market, but in my experience, in my opinion, there's only this patent from Silicon Medical because it's extremely rough. They have a really rough surface. All the other systems, because it's a very hard material, yes, we have more than 1400 MPa, then you cannot manipulate good the surface to make it rough. And they have the name patent coming from patents because they have 14 patents on this product. And if you have this surface very rough, fantastic. Super osseointegration. There's a Professor Becker from Düsseldorf University. He proved 7 years ago already long-term study with 98%. It's 95.8%. It's fantastic. And you bond with Unicem Helix from 3M Esper. You bond the glass fiber post on it, and that's all. Here's the procedure. This is very, very modern and also minimally invasive with the method MIMI. Very slowly. You have 20 RPM. You will get 30 Newton centimeter maximum, please. And then it's finished. You can control it again. You do your X-ray control, okay, but this is all. So, 10 weeks later, I'm doing the impression. You see, you take a normal impression tool material with a closed tray. You don't have to need individual formed or blah blah blah. Impression takes time, 5 minutes, and it's good. So it goes to the lab. And then we have the post. It's a glass fiber material. You bond it into the C connection of the patent implant system. So here is it. You take off already the with the material, otherwise you cannot, when you glue it now, you don't have any chance to take it away. And then simultaneously you fix the crown. You take off as well here. The crown is closing 1 millimeter deeper than the C connection, so you don't have any problems. So very nice. This is Mimi in perfection. That means really no blood, no pain for the patient, and it's really perfect. The results are fantastic, amazing. With Mimi 2, with sinus lifting, it's easy to handle. And my last golden rule is immediate implantations, but I don't want to destroy your lunch, yes, lunchtime. This topic takes time 1 hour, and I will present you some or 3 cases, I think. It takes time 3 minutes because you already gave anesthesia to the patient and you extract the tooth, and some minutes later, only 5 minutes later, you place 2 implants into the bone, which you're seeing, and it's amazing. There's blood, there's vasculation, and all is there. Also in this case, we have an emerging profile after 12 weeks, and then you can fix the crowns on it. So X-ray control. As well with titanium implants, naturally. You can do immediate implantations. And wonderful subcostal implantation. It's important also to keep it in your mind. Also in the aesthetic area, we place more and more the patent zirconium implants. After 10 weeks, we fix we bond the post in the implant. We can prepare this little part of the zirconium implant as well. And after 3 months after operation, you get such amazing, huge results. Okay, the 10 golden rules. Every general dentist should offer implantology in their practice, in their daily work. Second, implantology is nothing out of the ordinary. Do not change your behavior, please, in your daily work. Take no health risks for your patients. Work with the nature, not against it. Biointegration, protect the periosteum. Fourth, Mimi is the most modern process in dentistry, state of the art since 25 years. Low speed snip navigation, prosthetic guy from Ali El Hamid. No mucoperiosteal flaps anymore, and no re-entry of the gingiva. Subcostal implantation, de-stress the cortex. Seventh, as bone replace material, if it's possible, if the patient's got the keep the teeth, use autologous teeth material as bone replace material. There are no limits for Mimi anymore. There's even sinus lifting and Mimi 2, the horizontal distraction of the bone. It's possible without mucoperiosteal flaps. Titanium is being replaced by zircon implants, and immediate implantation is the future in dentistry. So conclusions, KISS, yes, keep it safe and simple. Reduce the interventions of patients from 5 interventions to 2 sessions only. Simplification of surgery. No need of a micromotor investments. No need of a CTPC. We have SNP as the best navigation program existing from the nature. We have simplified the prosthodontics. The lab, it's not easy but simple, easy to learn, to avoid the risk of peri-implantitis and complications, and earn money, become rich. Mimi is magic. And this is a nice film for my Dr. Taha, my dean. He's a wonderful guy and he loves to educate young people, and he's always a step ahead. Like in the film from Africa. Say the antelope. So thank you for your attention, and this is my email address if you have some questions. I still being here. Nejat at t-online.di. Mobile WhatsApp number 0049 151 1525 3692. And many greetings to my wonderful colleagues in India and worldwide. And it was a pleasure to be with you. Have a nice day. Yours, Armin Nejat.
Thank you, Dr. Armin, for your wonderful lecture and your technique. This technique is going to make implantology easier. You have shown us a lot of cases which look very easy than the conventional techniques. We were also able to see the kind of work you do in your daily practice in your country. Saying all this, we have a few questions for you. Dr. Armin?
Hello, Dr. Armin.
Dr. Armin? Can you hear us, Dr. Armin?
I think he's gone offline.
No, he's
Do you hear me now? It's better?
Yes, Doctor,
Yeah,
we
yeah.
can hear you.
Okay.
Okay, Dr. Armin, we have a few questions for you.
Yeah.
Regarding the shuttle we were talking about, it will definitely prevent second stage surgical procedures.
Yes.
But during a indirect sinus lift, will forces on this shuttle cause implant to fail?
It's about 30 Newton centimeter. 30 Newton centimeter, it's enough. You need only, you're needing only 3 millimeters of bone to have a primary stability.
Okay. So with 3 millimeters of residual bone height and 30 Newton centimeters of torque, we can do a indirect sinus lift and place the implant, correct?
Correct.
And regarding this de-stressing of the cortical bone, what do you mean by that?
Okay, in the cortex area, we have, when we have too much forces for the bone will be resorbed. That's why I take at the final step, for example, a 4.0 millimeter diameter drill to not have too much pressure in the cortex area. And this is de-stressing the bone in this cortex area.
Okay, so in the cortex area, you drill wider.
Yes, I drill wider than the diameter of the implant. Yes, correct.
And,
or the second possibility is to implant 2 millimeters subcrestally, deeper. It's also possible.
So when we go subcrestally, will there be difficulty to remove the shuttle?
No, not at all. It's, in my opinion, in our experience of 500,000 revolutions, it's better when the implant is placed subcrestally than a bone level, because the shuttle has a highness of 3.5 millimeters, and we don't want to have lateral movements on the implant during the first 8 weeks. So it's good also as well for the implant itself, for the healing process, remodeling process, that we don't have any implant part, the shuttle including in the mouth of the patient. So subcrestally sure is better than bone level for all conical systems.
Okay. Okay. So you were showing some cases, excellent cases, which showed where you have been placing implants when the width of the bone is very thin.
Yes, this is Mimi too. For narrow bones, when you have narrow bones, you just, without mucoperiosteal flaps, you distract the bone. Yes, it's very easy.
You're doing that using diamond burrs.
Yes, the beginning, you take a diamond with a turbine, with water irrigation, and then you begin always from lingually, from palatinal, orally, to win 1 millimeter of the buccal plate. Yes, you will win. 1 millimeter, and the most important thing in this technique is the periosteum, who is really mobilizing as well to buccal.
Okay. But how do we know where we are cutting?
No, you feel it. You feel it. The cortex is much harder than the cancellous part of bone, and you feel it when you are drilling, and you can control it with your metal zonda that you are in the spongious part, in the cancellous part of bone. It's just 2 millimeters. Okay. It's like bread. Yes, the bread also as well in India, it's very hard outside, and in the middle part it's softly. So it's like this, we can explain bone. And the periosteum is still intact. That means no injured part of the periosteum. So everybody is happy, and the implant will be well integrated.
Thank you, sir. Sudeep, sir, do you have any questions, sir? Sudeep, sir, you're on mute, sir.
Hello, Dr. Ermin.
Hello.
Yeah, your presentation was wonderful. And
Thanks.
I just have a question for you.
Yes.
Sir, in a medically compromised condition, especially for diabetic patients, whether if the shuttle gives any problem for osseointegration?
I didn't hear exactly the question. What was the question?
Okay. In a medically compromised condition, especially diabetic patients. Yeah, can you hear me?
Yes.
For diabetic patients in medically compromised conditions.
Yes.
Yeah, whether the osseointegration is related to that shuttle. The shuttle will be there for that. So whether the osseointegration there's any problem for the osseointegration procedures, or
No, it protects very well the osseointegration or biointegration. We changed a little bit the term osseointegration to biointegration, and the shuttle. It's a hermetic thing for the implant that normally with the other systems you contaminate the area peri-implantar area, and so the shuttle is sterile on in the implant, and you let it. And also for risk patients like diabetes or heart attack patients, it's much better. And the only thing with the shuttle is that there are no, it's not explored in the mouth of the patient. This is a little bit tricky. So we discussed already that I prefer to implant the revolution system 2 millimeter deeper than bone level. And the shuttle is a simple thing, but it's genius because it has 4 points together. Yes, insertion tool. You don't deform your implant directly. Yes, because the shuttle protects the deformation of the implant itself when using more than 30 Newton centimeter. Second is the impression tool, that you don't need to reopen always, and for the framework you don't need to open it for an impression. You just put your transfer into the shuttle, yes, and not in the implant. You don't need any X-ray and so on. It's much quicker than without a shuttle. And there's no contraindication for the shuttle. It's a big help for us.
Okay, thank you. Thank you, sir. Thank you. Over to Taz sir for comments.
Yes.
Questions. So you're on unmute, sir.
Now we have come to the end of the question and answer session.
Oh, that's Dr. Taha. Dr. Taha.
Yeah, very nice seeing you, nice hearing you after very long.
Thank you.
It was a wonderful lecture. You are the champion of champions. Champion implants is unique. It's unique because there is no system in the world like champion implants where the system that there is no need for raising the, wherever possible, no need to raise the mucoperiosteal flap. And, very, it's a bone condensing system. And with a slow speed, you can do the job, no bleeding, no,
Yes.
And of course, this is the only one of its kind I have seen. I have traveled almost all over the world to see different systems, all conferences, but this is the only unique system that I have seen. Thank you very much for being with us. Hopefully, we will meet soon. And
Yes.
we will be conducting a couple of courses also in
Yes.
the coming, once the pandemic is under control. Thank you.
Yes.
Thank you very much, Dr. Ahmed.
Thank you very much.
Thank you.
And big kisses. And I will follow your lectures as well after lunch, your lunch.
Thank you.
Okay, thank you.
Thank you.
Okay.
Thank you, sir. I would like to take this opportunity to thank Dr. Armin Najat for that extremely informative session. I also extend my gratitude to the moderators of the session, Dr. Sudeep and Dr. Roshan. And now we'll be breaking for lunch. The next session will be starting by exactly 1:30 p.m. I request all the concerned departments and attendees to reach the auditorium by 1:20, 10 minutes prior to the commencement of the second session. Thank you.
Good appetite for the lunch.
Thank you.
See.